If you're someone who's considering voice feminization surgery, something like a glottoplasty, you might have wondered why your surgeon has recommended therapy before and or after your surgery. So why is this? Well, many of the studies done on voice surgery have shown that combining it with therapy maximizes the results. Now, pre-surgery, we do always recommend people have a course of voice therapy because we know that more sessions actually helps people achieve their goals. So when people have only had a couple of sessions, of course, they haven't often achieved their goals. And sometimes they lose confidence, but sometimes it's just a question of carrying on for longer. But say people have carried on for longer, or say they haven't got the patience to, and they opt to go for surgery. Well, if a therapist hasn't seen you before, it's very hard to pick up on you straight post-surgically. So it's actually a good idea to have a pre-surgery assessment with a therapist that your surgeon recommends. And that's so that we can go through the voice care advice post-surgery. It's also to give you a space to be able to talk about the surgery. It also allows the therapist to get to know your voice and to pick up on any other issues that might be going on. So some voices pre-surgically might have a bit of hoarseness, and that usually needs to be resolved before the surgery. So we're doing some rehab work to make the voice as smooth as possible pre-surgery. Post-surgery voice therapy sessions are aimed at rehabilitating the voice so that the hoarseness will settle down quicker and the voice can develop its strength more quickly. By helping a client use certain exercises just to help the vocal cords closure and a little bit of stretching, that will develop the voice in a safe way rather than just allowing the voice to develop of its own account. Because for a while you'll have needed to have been silent with voice rest, and then starting to use the voice gently using certain exercises can really encourage the voice to develop in a healthy way, in a safe way. Just like a dancer who'd injured an ankle, for example, would do some rehabilitation exercises with a physio to get their strength back in their ankle. It's a lot harder just to kind of start talking by yourself. So the initial sessions post-surgery are aimed at voice rehab and helping the voice settle down and start to develop. Beyond that, people might want to develop their voice a bit further because one of the compromises sometimes from voice surgery is losing power or volume. And it can come back sometimes just by waiting and seeing, but also it can be developed in a safe way by having more therapy sessions. It's something you might want to consider once the voice hoarseness has settled down. And remember that the voice surgery is designed to change the pitch primarily. So aspects such as intonation will usually still benefit from a bit of guidance, especially if you haven't done much of that before. When I was asked by a voice doctor and actually otolaryngologist to write an article about this, he wanted me to discuss the points that perhaps a doctor hadn't thought about. And it's also very useful for clients to go through some of these points. So one of the little known points about voice therapy is we work really closely to help clients develop vocal confidence. And that's an important aspect of voice change. And even with surgery, a client might not have vocal confidence or enough vocal confidence to use the voice or even to adjust to the voice. So being able to develop the voice, get it stronger, be able to speak louder, working in different social situations, they're all therapeutic aspects, sometimes what we call meta-therapy, beyond the obvious things like working with resonance and pitch and intonation, just developing things like vocal confidence and vocal ability. It can be disappointing to hear that people might still need to combine their voice surgery with therapy. And I totally understand that because it does take a bit of patience. Remember, any voice change does take a bit of patience, whether you're just going down a surgical route or just a therapy route, because the therapy route will take longer and the surgery route might seem quicker, but it will also need some time for the voice to settle down and for the post-surgery phase to pass. While some people will only wish to have voice therapy because perhaps they're not keen on surgery at all, and they'll do well if they complete their voice courses, other people might be very interested early on in having surgery. And for those that are interested in surgery earlier rather than later, then a combined approach is recommended by most surgeons and voice therapists to help maximize the potential of the voice, keep it safe and healthy, and minimize any hoarseness that might hang around. For clients who wish to work on their voice just through therapy alone, and that's very possible, having done it for many years with many hundreds of clients, I've made a video about how voice therapy alone without surgery works for many people, and you can watch that video here. If you found this video helpful, click the like button and subscribe to the channel.